My name is Madeline Arabo, and this is my Professionalism and the Future of Marriage and Family Therapy presentation. In this presentation, I will be exploring the role of ethics and law in marriage and family therapy, particularly in multicultural contexts, recovery-oriented care, and integrative mental health systems. I also want to reflect on the evolving landscape of the MFT profession and what the future may hold. To bring these concepts to life, I will be incorporating insights from two powerful practitioner interviews, one with Ronza Raffo, a seasoned family attorney, and the other with Diana Raban, a licensed clinical social worker with deep experience in public mental health systems. Cultural sensitivity isn't a side note in therapy, it's foundational. The AA MFT Code of Ethics underscores the need for competence in working with diverse populations, and for good reason. In an increasingly multicultural society, therapists must not only be culturally informed, but also culturally humble, actively checking their assumptions and adapting their approach to fit the client's worldview. This idea came through clearly in my interview with Diana Raban, who works with refugee and immigrant populations in community mental health settings. She shared many of her clients come from collectivist cultures where emotional expression is not always encouraged, and privacy is often seen as a family matter, not an individual right. For example, one client expressed confusion and distress about being asked to discuss private matters without involving their parents. What might seem like a basic ethical obligation to a marriage and family therapist, like protecting individual confidentiality, can feel alienating or even disrespectful to someone from a different cultural background. This is where ethical competence requires more than memorizing codes. It's about the intentional application of those codes with cultural attunement. Diana emphasized the importance of relational engagement, sometimes offering culturally adapted metaphors or using language that resonates with the client's cultural values. For example, she might reframe therapy as restoring family honor through healing rather than as individual insight work. Ethics demands that we do no harm, but in multicultural contexts, harm can result from rigidity, even if we're following the letter of the law. Cultural humility, consultation, and continued education must work hand in hand with the Code of Ethics. In my conversation with Ronza Raffo, she shed light on the legal complexities that often intersect with therapy, especially in cases involving families navigating divorce, custody battles, or undocumented status. From her perspective as a family law attorney, she's seen how therapists can be caught between ethical neutrality and legal reporting obligations. One issue she raised is how therapists may unintentionally be used to build a case, especially when working with high conflict families. She shared a powerful example of a therapist who submitted clinical notes as part of a custody dispute, without realizing how those notes would be interpreted by the court. What was written with therapeutic intent was reframed in court to suggest parental unfitness. This speaks to the ethical principle of informed consent, not just for treatment, but for documentation. Are our clients fully aware of how their records might be used, especially when therapy intersects with the legal system? This conversation reminded me that marriage and family therapists have to hold dual accountability to clients and to the legal systems in which they sometimes operate. We must learn to document ethically and neutrally to understand the implications of subpoenas and to navigate privileged communication with clarity. And perhaps most importantly, we must understand when to seek legal consultation ourselves, especially in high-stakes family cases. Diana also spoke about how ethical practice and public systems must reflect recovery-oriented principles, dignity, autonomy, and empowerment. In many public agencies, clients are involuntarily referred or face external pressures like housing insecurity or probation. The therapist's job isn't just to provide a diagnosis. It is to humanize the process of healing with an often dehumanizing system. She mentioned that in many intake sessions, clients are overwhelmed by paperwork, trauma screenings, and clinical assessments that don't yet feel relational. Ethical care in these settings means finding small ways to restore agency, like letting clients decide the pace of disclosure or whether they have a support person present. This is particularly important for clients with complex trauma or marginalized identities. Diana described a client who had been misdiagnosed multiple times due to cultural misinterpretation of symptoms. What was seen as paranoia was actually a realistic hypervigilance shaped by years of systemic discrimination. Her ethical responsibility was not only to treat the client's symptoms, but to reframe the narrative around those systems in a way that validated rather than pathologized. The future of marriage and family therapy is undeniably interdisciplinary. More and more therapists are working in integrative health settings alongside physicians, case managers, and even spiritual care providers. This is an exciting evolution, but it also raises ethical questions about collaboration, scope of practice, and boundaries. Both Ronza and Diana stress the importance of knowing our role on the team. For instance, marriage and family therapists may be asked to weigh in on a client's ability to parent or whether they are compliant with medical care. These are ethically loaded questions and require us to define our input carefully and avoid stepping into evaluative or diagnostic roles that fall outside of our training. It is also essential that we advocate for systemic changes within these interdisciplinary spaces. Diana reflected on how often she brings a relational lens to team meetings, reminding medical professionals to consider how family dynamics might affect treatment adherence. In doing so, she models the value of systemic thinking and holistic care, which are core tenets of marriage and family therapy. Looking forward, the field of marriage and family therapy is evolving in exciting ways, and with that evolution comes responsibility. We are being called not only to adapt, but to lead. As our field expands into community-based settings, schools, telehealth platforms, and even policy-making spaces, we must keep ethics at the forefront of everything we do. I asked both interviewees what they think the next generation of therapists need most. Diana said, compassion without saviorism. Know your clients' strengths before you try to fix their pain. Ronzo echoed that by emphasizing the need for legal literacy, not to practice law, but to ethically protect yourself and your clients. Personally, I see the future of marriage and family therapy rooted in continued growth, flexibility, and courageous humility. We will need to advocate for equitable access to care, dismantle barriers rooted in systemic oppression, and reimagine what culturally responsive care really looks like in action. This includes offering services in different languages, building trust with historically marginalized communities, and challenging models that center whiteness as the default. Ethics and law in marriage and family therapy are not static. They are dynamic, contextual, and relational. They call us to be reflective, informed, and courageous in our practice. They ask us to meet our clients with curiosity, not assumption, with respect, not judgment, and with a steady commitment to doing no harm, even when the path isn't clear. Thank you.